Dr. Plana, take 3.
All right, Dr. Plana, so tell me a little bit about yourself, where you come from, how you got to New York.
I'm Dr. Natalie Plana, and I'm thrilled to be joining the team here at Hanna Face and Jaw. I guess my story starts back in Miami, which is where I grew up. I had a very fun childhood, big family, Cuban background. But when I was young, my mom put me in dance, and it turns out that I was a little bit better at it than I thought. When I was in high school, I came all the way to New York City and I auditioned for the AV school, never imagining that I would actually make it. Lo and behold, I made it into the AV school. That was it. New York City was my new home. I went to NYU for medical school, and it was there that I met some of my very strong and influential mentors, Dr. Eduardo Rodriguez being one of the strongest. He gave me a very unique chance to work with him and his facial transplant team, where I spent 2 years doing research with him, and I got to see 2 of the most extensive transplants performed to date just as a medical student. After med school, I got formal residency training in plastic surgery at Penn and CHOP. Some of my more fond mentors at Penn are Dr. Joe Cerletti, Dr. Jordan Swanson, and it was really the compassion that they had for patients that made it a natural fit for me as their mentee. After residency, I came back to New York and I pursued a specialized fellowship training in cleft and craniofacial surgery. I wanted to get the absolute top-tiered training that I could to be able to deliver the best results that I can for my patients. Fellowship is where I was really able to hone in on my skills and take my ability to the next level. My vision is really to be able to combine a number of procedures that can achieve best facial balance and harmony. So I'd like to focus on orthognathic surgery or jaw surgery, a number of cosmetically enhancing facial procedures that could be rhinoplasty, eyelid surgery, and other facial rejuvenation procedures such as facelift and neck lift. I'd like to focus on cleft and craniofacial care for young children who are born with birth defects or birth differences. I have a broad foundation in general plastic surgery, so I certainly welcome the ability to care for patients with diverse needs. I chose plastic surgery because it's a very elegant type of surgery. It's not just operating, it's not just about techniques, but there really is a creative side, and my interest specifically in facial reconstruction comes from the fact that no 2 faces are the same. No 2 operations will ever be the same. So having a unique challenge with every case and every patient that comes through was very attractive to me, and it really allows me the chance to get to know an individual and see sort of who they want to be in the world and give them the chance to let their appearance reflect how youthful they feel or how confident they actually are.